Find out more and head on over to supertalktv.com. You'll see I'm not alone in the studio today. Got two lovely ladies visiting with us to talk about a new number that could help save a life. Joining us is Miss Wendy Bailey. She's the Executive Director for the Department of Mental Health. And we have Miss Katie Storr. She's the Chief of Staff for Mississippi Department of Mental Health. So welcome, ladies.
Thank you.
Thank you for having us.
And I know you guys have been keeping this big old secret for like a little while now. I think Katie, we started talking about this way back in May when it was Mental Health Awareness Month. And you're like, oh, let's pump the brakes on it for at least a little while longer. So what's coming up July 16th? Who wants to take the stab at it?
All right, so July 16th, a new 3-digit, easy-to-remember number is going to go live that connects people in crisis. It's going to be a suicide and a behavioral health crisis line. It's going to connect you with the National Suicide Prevention Lifeline counselor, and that person's going to be there to talk to you, assess the situation, and connect you with care when needed. It's replacing a 1-800 National Suicide Prevention line, which, for those who are aware of that number, it will still work for quite a long time, but 988 is there for easy access to the behavioral health crisis system here in Mississippi and to connect with a trained counselor that is there to respond when needed.
So who finally said, okay, the 1-800 number is great, but like that's hard to remember. I'm not going to take time to like Google it. Where in the conversation did it finally say, you know what, we have 911, let's make it as easy. We have 811, let's make it as simple more simple for folks to remember. Wendy?
Well, it's actually interesting that you brought up 911 because that's exactly what led to it. Congress passed in 2020 legislation in Washington to establish this, and the whole point behind it was you have a 3-digit 911 number for any type of healthcare crisis, and that's what they wanted for behavioral health as well. And it started off, like Katie mentioned, for suicide prevention and suicide awareness, and then it's led into this whole behavioral health line. So it was actually Congress and a national push for this. And then in Mississippi, our state took a lead in funding and legislation that was passed in order to make it a priority here for our citizens as well.
So does each state have a different 3-digit number?
No, it's 988 across the nation.
And then I guess just the way the system works, they'll just know that you're calling from Mississippi to sort of.
That's right.
Because I guess I never thought about that. You call 911 in Mississippi, you call 911 in California, and it just knows where to go. How does it know that?
Well, it's the same way with the number, the National Suicide Prevention Lifeline number before the long digit number. It was routed to Mississippi, so it basically knows your area code and it routes the calls. And the way that was set up is after so many rings, if someone doesn't pick up here in Mississippi, it rolls to the next state. And we are very proud that our state has one of the highest answer rates in the nation for the Lifeline. But it's basically based on your area code.
Oh, okay. Well, that makes a little bit more sense. So where is this sort of, again, thinking of the 911 sort of model, you've got all of these great phone operators that are trained and they're, taking the calls and they're getting the people there. It's a whole thing. So where is the thing? Where's the, where is the mothership of those that are sitting there waiting for the phone to ring?
So in Mississippi, we have 2 Lifeline centers. We have one in Jackson called Contact the Crisis Line, and they primarily cover the state. And then we have a smaller center in Columbus, Mississippi called Contact Helpline, and they cover an additional 8 counties. Both of them serve as primary and then backup coverage for each other. So if you don't reach someone at Contact the Crisis Line, you'll then roll to Contact Helpline. And then if for some reason all of the phone lines are booked, it would roll to the next state, like Wendy mentioned earlier.
You think, who's going to call if they're feeling that kind of way? But folks actually use this resource, right? Like it's actually helped to save, well, the 988, not yet, but the 1-800 number has been a lifeline for many folks. Mm-hmm. How many, do you know about how often it gets used?
So in Mississippi, for the National Suicide Prevention Lifeline, we had We usually average between about 6,000 and 8,000 calls within a year. The last couple of years, those numbers have been up, but we think that's due to the COVID pandemic and just so much stress that people have been under. And then we have mobile crisis response teams in our state as well. And those numbers are promoted for 24/7 crisis response for behavioral health. And with that, we average around 30 to 35,000 each year calls and follow-up calls. So people do reach out and people do ask for help. And that's why it's so important that we have this here. You know, we need to, one of our priorities at our agency is to increase access to care and to provide hope to people. And that's exactly what 988 and the Lifeline does.
So I understand if you're having, intrusive thoughts about maybe ending your life, or you see someone who's feeling that way, that would be a reason to call. But what are the other, give me a tangible reason someone else would call the 988 if is it like a panic attack, or if we're starting to just, have a mental breakdown? I mean, I know suicide, absolutely, I can wrap my brain around that. But what would be those other moments of mental crisis that someone would want to call or need to call?
Sure. And that's one of the most exciting aspects of 988, because before it goes live, it has been promoted as a suicide prevention lifeline. But moving forward, it's going to be promoted as suicide prevention and behavioral health crisis line. So families can call when they're concerned about a loved one. Maybe someone has a history of mental illness and they are seeing behavior changes, and that person is in a crisis at that moment and they need help. They will be able to call 988. It'll be an easy number to remember. They're not going to have to think through, what door do I open to access the system? Do I need to call their doctor? Who do I need to get? It's in the middle of the night. They may not remember there's mobile crisis response teams, so they have 988, and they can call that one number just like they would for 911 for emergencies, and get access to that counselor who's going to be that open door to get them into the system and the care that person needs.
Those mobile response teams, and now I'm seeing a squad headed to your house, right? Like 911, you call and you get the ambulance and you get the fire trucks or whatever it is you needed. Is that someone coming to your aid, or is that more of a digital kind of response?
So about 80% of the time when a call comes through, it can be, that situation can be de-escalated over the telephone, or you can have someone connected to the care and the treatment that they're going to need. But then you do have times where someone does need to respond in the field. So that, in those situations, the mobile crisis response team can go out. Sometimes they will also go out in conjunction with law enforcement, like a crisis intervention trained law enforcement officer. So you do have field responses, and then you do have those just over the telephone responses as well.
So when this goes live, I'm just how does it work? I mean, is it like it flips a switch and it's like 988 is working? Or, I mean, is it a little more complicated than that? I feel like there's a button to be pushed. I want to push the button. I don't know.
The big red button.
The big red button that says, 988. You are ready, you are activated. I'm not sure,
So when you call 988, you will be connected to that trained counselor. We are in the process of developing protocols for interconnectivity between all of the systems. So it's not going to be a light switch moment yet that the entire system with your big red button is ready to go on July 16th, but the pieces are there. Mississippi is in a fantastic place because we do have mobile crisis response teams throughout the state. Mm-hmm. We have our centers with already a 90% average in-state answer rate. There are crisis stabilization units for people who may need a higher level of care. So the pieces are there. We have had a planning coalition that has been meeting over the past year, working together and continuing to work. So it's going to take a lot of collaboration, a lot of working together to get the system with the future vision of basically a 911 system for behavioral health crisis care.
What are the other major departments that had to come together to do teamwork with this?
We worked with members of the Community Mental Health Center, advocacy organizations, people with lived experience in the community. We worked with other state agencies, and we're continuing our work with 911 administrators and law enforcement officers. We held a community forum in May for first responders. That's right. We held 2, one for first responders. We wanted to hear their feedback on what they need from a crisis system to help inform our planning efforts, and then another one with people with lived experience to make sure those voices are heard and incorporated into the planning.
Well, we want to make sure your voice is heard. If you need help, you'll be able to call 988 coming up July 16th. But we've got more with the Mississippi Department of Mental Health. Come find out more. We're finding out more about the mental health, life crisis line that's going to be coming on, or health crisis line, should I say, behavioral health crisis line. I keep talking and I'm going to get all the words in. Suicide prevention and behavioral health crisis line 988. It's going live July 16th, and we're continuing our conversations with Wendy and Katie with Mississippi Department of Mental Health. And you guys are like really excited about this, which is kind of odd because, you know, you're talking about suicide prevention and, you know, but you're looking at it as a resource to get to folks in need. And why wouldn't you be excited about something like this coming online? Katie, you were talking about if and when they call 988, they will get a trained counselor on the other line. Just like if you call 911, you get a trained, phone operator that knows exactly how to handle or get you what you need. How are you finding those counselors? Are you going to need more counselors? What kind of training? Tell us about the counselors.
Absolutely. They are going to need a lot more counselors if anyone is interested, because they will be staffing up to meet the demand of possibly increased calls with the easy-to-remember 988 number. So counselors have to meet minimum standards of the national Lifeline. There's new operational standards that they have to meet, and they go through specific training on how to talk to people over the phone, to assess for an imminent risk, to ask questions in a way that are culturally sensitive and diverse, and speaking to them about a multitude of issues as to why someone may be calling. So beginning in July, the Lifeline Centers will have received some funding from the Department of Mental Health to hire more. There is actually a 988 hiring page, and I wish I had brought it with me, but I have a feeling Google will bring you right to it if you search for it. And it has every state listed in their open positions. So there will be a great need for additional counselors to answer the line.
Where would be home base for that counselor? Would it be something where it would be telehealth? I mean, because they're answering or fielding calls, or is it going to be where, you know, they would need to be here in the central area?
So both of our centers here in Jackson and in Columbus, Mississippi, have said that they are going to do some rotating schedules with some telework and some in office. They want to give those counselors the support they need to be in the office with others, to talk through situations and scenarios, but there will be some opportunities for those counselors to work from home as well.
Because I feel like those counselors are going to need their own 988 number. No, but right. I mean, you have to support. I mean, it's obviously you're not having a good day if you call 988 or 911. I mean, that's what they're, there for and trained. But you talked about too, Wendy, that there's a text option as well. So it may not be, or text and sort of chat. So how are you guys trying to find and meet people wherever they are with whatever technology they have?
Well, that is one requirement of it, and we are working towards that here in our state, and that is the ability for chat and for text both. So you would have that option, and we also know, especially with the younger generation, they're most likely not going to call the number. They're going to either text or chat. So both of those options will be available.
So this will be open, and obviously you wouldn't turn anybody away, but will the awareness and the marketing and all that get out to the high schools and the junior highs and the, to that vulnerable population?
Yes, that's right. Actually, every state had to develop an implementation plan that was approved nationally, and Mississippi had one as well. And there are subcommittees on that workforce, that team that has been working on the 988 plan here in Mississippi, and one of those committees is marketing. So there's a focus on how are we going to reach the different groups, because you have to have targeted marketing for these different populations. So that is absolutely an emphasis, and you're going to see a very heavily emphasis placed on that as we get more into the fall and the winter, and more time is devoted to making sure everybody is aware of that.
I think that's exciting, especially if a kid doesn't feel like they have somebody to turn to. Maybe they would just text and, reach out and know where they can, go to at least, and I mean, be talked off a ledge. I mean, or wherever they're at in that sort of way, especially too with so many rural areas in Mississippi. Mississippi went to the top when it came to telehealth in the beginning. We really got pushed, into that with COVID. So you're looking at a lot of your rural areas that just don't have access to counselors or trained therapists. And so this is a first step, at least connecting that. But this won't be like ongoing therapy for anybody. It will be a crisis line, correct?
That is correct. It's kind of, you need, for a good, strong crisis system, you really need, we look at it as like a three-legged stool. You need someone to talk to, and that's where you have a crisis line. That's exactly what 988 is going to be. Then you need someone to respond when it's a situation where you need more than just someone over the telephone or chat or text. And that is where our mobile crisis response teams will come in. And then somewhere to go, and that could be a crisis stabilization unit, are the connection to an appointment. So you've spoken to someone over the telephone and they know you need additional help, and you get connected with an outpatient therapy appointment. So it's a process, and you need all three of those things in place to have that good, strong system.
I keep hearing about these mobile crisis units. I'm like, well, that's a good thing in itself. I feel like, kudos to Mississippi for, having that. But it's not just open to select people. You were sharing, Wendy, about schools or first responders, and when you say that they may have had a crisis situation, who else listening to Good Things could take advantage of that if they're having a really upsetting situation in their community?
So I can give you two examples. There was a situation on the Gulf Coast where there was a suicide in a school, and the mobile crisis response team was called in to talk to students there at the school. So it's not necessarily a one-on-one response. Sometimes the team may go into more of a group setting and provide that assistance. Region 8, which is here in the metro area, they've responded before to a fire department who had a very serious situation occur, and their fire department employees needed some additional assistance and some crisis counseling. And the mobile crisis team went in and did that with the local fire department. So it's not just the family member or the individual. Sometimes there are these group situations as well that our mobile crisis teams respond to.
Which I think is just good for everyone to know. If you want, if you were having a scenario like that in your community, I mean, who do you call just for that? I mean, would that be the 988, or would that just be connecting to you guys in another way?
We have a helpline at the Department of Mental Health as well as 24/7, so that's always available. But 988 is going to be that main avenue, and we are partners with that. So of course that information would be shared with the department or the mobile crisis team in that area as well. It really is a statewide connection and partnership. That's why this work group that has been planning for over a year, all of those partners are key. And then the legislation that was passed this year to develop a study commission brings in even more partners. And that's really what's key, is that it takes all of us working together to make this change.
Our elected officials don't always get a toot-toot, and like working together or whatever, but it feels like they hit a home run with helping to support mental health in Mississippi.
They really did. We're on national calls, and you've still got states that are struggling on how they're going to fund 988. And our legislature, with ARPA funding this year, went ahead and appropriated 4.5 years worth of funding for both the implementation and the continuation of 988. And then we've received federal funding in our state too. And then they also, Representative Felsher from the Gulf Coast, he passed House Bill 732, and and Chairman Sam Mims was very instrumental in that as well. And it establishes a study commission to look at moving forward. How are we going to fund this? What crisis services are needed in the state? So they really did take a forward, proactive approach to bring this to Mississippi, and we appreciate that.
I always get just so encouraged every time we have the Department of Mental Health on, or many of the other advocacy sort of groups. There's just so much good going on in Mississippi, like boots on the ground trying to help. And I feel like still some folks don't realize all the resources that are out there for them. So if they are listening, I mean, how do we connect or find out more about getting a loved one help, or maybe waving the white flag finally for ourselves and our mental health? I mean, other than the 988, I mean, what resources can we get from the Department of Mental Health?
So, one thing that this has also brought to light is some areas that we definitely need to build and strengthen and focus on. And that's, our plan moving forward. But also, we have a website called mentalhealthms.com, mentalhealthms.com. And you can go to that site and you can actually search by county to find out what resources are available in your area. The Department of Mental Health's helpline number is available on that website, and that's 24 hours a day, 7 days a week. And then, of course, the department has a website, dmh.ms.gov. And all of those locations can connect you with resources in your area.
And Carol in Starkville texted in and said, thank you for the info. I'm going to be sharing with others. And I think that's the part of the beauty of today's conversation here on Good Things is just know this simple number, 988, is going to be made available. Soft launch July 16th, although I'm sure if you dialed it now, somebody would pick up the phone and wouldn't leave you hanging. Sorry, you got to call back on July 16th. We'll get to your crisis then. But if they did, I hope you laugh. But ladies, I feel like we'll be hearing more about this great program and all the other good stuff coming out of mental health. So thank you.
Thank you.
Thank you, Rebecca.
All right, y'all stick with us. We've